I just reviewed one of my clients' running form videos, and there were three things that immediately stood out. He had pelvic drop, knee valgus, and excessive pronation. Now, none of these things automatically means that you're broken, but when you combine them together, they can create more stress through the hip, the knee, the ankle, right, the foot, Achilles tendon, and I'm Dr. Ray Peralta, a physical therapist, run coach, and in this video, I'm going to walk you through what I saw, what it means, and what runners, especially over 40, can do to stay injury-free and run pain-free for life. So the problem, most runners only look at the pain, but not movement. They wait until they start feeling some pain somewhere in their body, starts hurting. Uh, and there's a couple camps. Some runners just ignore it. They just push through it until the pain becomes so bad that they have to go to the doctor's office, right? Or sometimes they have like a low level pain and they just let it compound. And then they start to realize, hey, you're maybe hitting a plateau, or this kind of ache or pain starts showing up. So like you think, oh, I just slow it down and I won't feel it as much. And getting a gait analysis, right, where you look at your running form, can help identify stress patterns before they become injuries. The goal is not perfect form. The goal is durable form, so you can enjoy running, for decades, right? Not just for one season and disappear for the rest of the year. So what I noticed in my client's running form is that he had noticeable pelvic drop. His knee started drifting inward, and at times his knee looked like they were almost bumping into each other. Right? He also had some excessive pronation. And each issue matters more when you look at how they interact together and giving someone's injury history. And why smash for runners over 40? Your recovery capacity is not the same as it was in your 20, right? Their ability to recover and bounce back from workouts or stressors. Also, as you get older, you start getting sarcopenia, age-related muscle mass. So strength loss can show up as poor hip, knee, or an ankle control or stability. Small movement leaks can lead to bigger injury risk over time. And running more does not always fix the problem, right? Some people think, oh, I'm just going to keep running more and more. Eventually, my form will sort itself out. But that's not always the case. Oftentimes, you need to do smarter training because running alone is one-dimensional sport. So if you just run alone, sure, are there outliers out there who've been running since they were 6 years old and have, mastered running? For sure, yeah, there's definitely outlier elite athletes who've been training at a young age. But if you're an adult beginner runner, like maybe you started in your running in your 40s or your 30s or 50s, what have you, maybe even intermediate. What ends up happening, though, is that maybe you work a desk job, you're going to have some stiffness, imbalances, and running alone is not going to fix that. Sure, it can help you with your mental health, it can help improve your cardiovascular fitness, but if you're not doing things to address your strength or mobility and even improving your form, because running is a sport like any other, and proper form does matter to an extent. Again, you don't have to be perfect, but if you have lots of areas that are causing you stiffness or pain, oftentimes addressing the form can oftentimes decrease your pain or these, aches and stiffness areas. And if you want to learn more on how to run pain-free after 40, I'm sharing my free guide, including this Google Doc inside my free school community for runners. Click the link in the description to join. So what I found during the Gait analysis, one was a pelvic drop, right? We talk about, we look at his pelvis, here's the left side support. You can see it's kind of dropping a little bit. And when the pelvis drops, it's going to put a bit more stress on the knee, right? This may increase the risk for like runner's knee, IT band, hip pain, or even shin splints. Right. So typically it indicates that the hip abductors, this glute medius muscle, needs to be a bit stronger to support the pelvis and keep it more upright, instead of letting it drop. The thing I noticed was a bit of knee valgus. So this is when the knee collapses inwards. Now, you could see here that left knee is almost like literally bumping into the right knee, like they're almost touching each other. So this can place more stress on the knee joint and the surrounding tissues, ligaments, tendons, right? And even affect the ankle and foot because the whole chain is interconnected, right? You could even put more stress on the Achilles tendon, even though it looks like the issue's happening more at the knee. And then we also looked at excessive pronation. Now, some pronation is normal, right? But when you have excessive pronation and you add it with the other factors I talked about, it could increase the risk of injury, right? It could put more stress on the ankle, the Achilles tendon, and the foot. You can see here on his right foot, the toes are sticking a bit more outward, indicating some pronation. Again, there's going to be some debate what's excessive pronation or not. But when you look at the whole upstream, what's happening at the knee, at the hip, this could be tell us, hey, there might be something we need to address, especially if he has a history of Achilles tendon issues or plantar fasciitis issue or stress injuries. This might be something that needs to be addressed or corrected to help minimize those issues in the future. So what most runners get wrong about running form, they think that one issue explains everything, right? Pelvic drop alone doesn't tell the whole story. Knee valgus alone does not tell the whole story, right? Just one, finding in isolation doesn't, you have to look at the whole body, the whole picture, how it moves together, but you have to look at the whole person, Running injuries are usually about load, capacity, and repeated stress. Mistake two, they just obsess over pronation. They hear, oh, pronation bad. Pronation is not automatically bad. Again, some pronation is a normal part of running. The problem is uncontrolled or excessive pronation under load, and if it's causing injury or pain. Like if you're getting pain every time that, let's say, in this example, let's say the right foot, every time that right foot excessively pronated was causing you pain, and it's an indicator, okay, hey, we need to address that pronation because obviously it's causing more pain in the Achilles or the ankle itself or the foot, what have you. Mistake number three, try to fix form without building up strength, right? You cannot chew your weight out of every movement, because what happens, you maybe are able to hold proper form for the first few minutes, but what happens when you're on a long run at mile 6, at mile 12, right? As fatigue starts setting in, your form breaks down, right? So you may be able to cue yourself to have proper form while you're fresh, but as fatigue sets in, your form breaks down. So you still have to make yourself strong enough to hold proper form for longer, so you're more fatigue resistant. And that's why doing proper strength training, mobility training, and I'm not talking about strength training for general fitness. I'm talking about addressing weak links, runner-specific strength exercise, training unilateral, single leg movements to really strengthen, whether it's the knee, the hip, the ankle, what have you, to actually remain properly controlled while you're going out for a long run. Form correction works best when paired with proper strength training. Again, it's not just general strength exercise. It's not just, I'm just going to go on the leg press. No, it's a really focused exercise for your weak links. And different runners may have different weak links they need to work on. So what you should do to fix it, right? So if, let's say, say it was your hip that's weak, strengthen the hip abductors. Hip abductors exercise like side planks, hip pikes, lateral band walks, single leg RDLs, Romanian deadlifts, step downs with good knee control. Step two, improve single leg control. This is single leg balance, single leg squats, split squats, right? Controlled landing drill, single leg hops. Build foot and ankle capacity, right? Let's say if it was your ankle that was an issue, you could do calf raises, tib ant raises, toe raises, foot intrinsic work, foot doming, different ankle balance exercise or drills, and then adjust your training load if needed. Let's say, you notice that you're programming, because sometimes it's an issue of programming, whether doing too much running or too much mileage. You may have to decrease the mileage a bit, maybe switch to a 3 runs per week framework to give yourself more recovery days so your body can recover from running. Use cross training to build up your fitness, strength training. And then if you want to reassess your running form, you can, but give yourself some time to adapt. It may take you 6 months, a year or two to really dial in proper strength training, mobility training, and smart run program, running form drills, what have you, that to actually improve your technique and your form. It doesn't happen overnight. This is usually like 6 months, a year, even 2 years of process. But I recommend at least waiting 6 months before trying to retest your running form again. Again, it's not going to magically just correct itself over the course of a few weeks or overnight. So when you use gait analysis correctly, you get clarity instead of guessing. You stop blaming random things. You see where your body's actually leaking stability, and you understand why certain issues might be getting overloaded, like maybe your knee, why it's getting stressed. Then you know what areas you may have to strengthen or mobilize. And you have a plan instead of just random exercises. Another thing, when running form is done properly, also taking account the full picture, of course, not in isolation, you could help reduce injury risks, prevent future injury. You have maybe controlled the hip, the knee, the foot, to help, those different types of running-related injuries that may be happening. And you become a more durable runner after 40, so you can enjoy running for longevity as you get older and be able to run marathons well into your 50s, 60s, and beyond. So I currently have a few spots open to work with me privately for one-to-one to help you run pain-free, rebuild your body, and train smarter after 40. If you're curious, there's a link to apply in the description. First come, first serve. So in conclusion, lesson 1, running form is information, not a life sentence. Lesson 2, pain-free running starts with better capacity. And lesson 3, runners over 40 need durable form, not perfect form. So if you're over 40 dealing with knee pain or hip pain or any other type of issues, don't ask what's wrong with my form. Instead ask, what does my body need so I can keep running pain-free, whether it's strength, mobility, maybe it's combination with the form. Like, it's not just one thing in isolation. If you found this useful, hit the like, comment, and subscribe, and I'll see you on the next one.